I'm Dr. Joe Galati, and thanks very much for looking at this video on how we perform a liver biopsy. Once you're admitted to our endoscopy unit, your medical record will be reviewed, and one of our nurses and technicians will take you into the endoscopy unit where the procedure will be performed. You'll be monitored throughout the procedure with blood pressure, heart rate, pulse, and oxygen saturation, and you'll have an intravenous line running, which will provide you not only with hydration but sedation that we use, consisting of Demerol and Versed. One of our technicians will clean off all of the equipment to get you prepared. We do have an ultrasound machine that will help us in performing the liver biopsy to carefully localize the liver and minimize any chance of complication. For years, I've been using the Arrow liver biopsy kit, which has all of the necessary pieces of equipment. So once we get the room set up with sterile gloves, a gown, eye shields, we're ready to start the procedure. Now, in the liver biopsy kit, the needles, syringes are all contained. We use lidocaine to anesthetize the skin, and there is a small scalpel on the kit to make a small nick in the skin to easily pass the needle. Now, what I'm doing here is locating the liver by percussion, and here for this demonstration I'm using a Sharpie marker to locate where the incision and biopsy will be made. Typically, we go in the midline of the armpit, right at around the area of the xiphoid process, which is that small bit of bone that hangs off your sternum. We'll then confirm the location with ultrasound, which we do right before the procedure gets underway. There's a small amount of ultrasound gel that is then wiped off without any problems. And again, throughout this procedure, the nurse and technician are monitoring vital signs. Here's an image right before we start the procedure. One of the first things that we'll do is we'll clean your skin with betadine to sterilize and clean off the skin. In all the years that I've been doing thousands of biopsies, I've never had a problem with a skin infection after the procedure. Using the betadine certainly minimizes any risk of complication. As a side point, all patients that are going for biopsy have their platelets checked, and we make sure that there's no bleeding disorder or making sure that they're not on any medications that could increase the risk of bleeding. So this is a picture with the betadine in place. What we'll do next is I'll put on sterile gloves, and inside the liver biopsy case there is a sterile dressing that we will put over the skin that has been cleaned with betadine. And again, this will create a nice field that is clean and cuts down on any risk of infection. Notice again that the patient is quite quiet. The anesthesia that we give, the Demerol and Versed, or sometimes fentanyl and Versed, is given in small quantities during the procedure, depending on how much they may need to keep the patient quiet and comfortable. In many cases, the patient's still able to communicate with us and comment if there's any problems that are going on. The first thing that we do is we'll take the lidocaine, which is a local anesthetic, and we'll fill one of the syringes. And then with a very small needle, typically we call this a skin needle, we'll infiltrate the local skin around the biopsy site to deaden it. Now again, the anesthesia we're given by vein, the Demerol and Versed, is usually enough to make the patient comfortable, but we will use the lidocaine to further deaden the skin in that local area. It's very unusual for patients to have any discomfort once they go home. If they do, we tell them to take just a little bit of Tylenol. Of course, we want them to avoid taking aspirin or other non-steroidal anti-inflammatory agents which can lead to bleeding. So here the skin needle is just injected right under the skin, where about 10 cc's of the lidocaine is used to deaden up the skin. And as you can see, there's very little bleeding. The patient is quite comfortable throughout this part of the procedure. When patients come for the procedure, we certainly want them to come with a driver. It can be a relative or friend of the family, because with the sedation, the general rules are that for the remainder of the day, we don't want them to drive or operate any heavy equipment because of the sedating effect and the effect it may have on your reflexes. All of our liver biopsies, as mentioned earlier, are done at the Texas International Endoscopy Center in the Texas Medical Center. Next, we'll be filling up the syringe with saline for the liver biopsy. The needle that we use for the liver biopsy is called a Klatskin needle, and that was named after Dr. Gerald Klatskin at Yale University, who was a very famous liver pathologist. And certainly we've had the best luck over the years with this needle giving us a good sample. Now what we're doing here is to ease the passage of the needle, we make a small nick in the skin with a small scalpel blade. And in most situations, within a week or so, you can barely see that there's been any incision there, and certainly by 6 months the little incision is just a faint little scar with no further problems. There's a little bit of bleeding at this point, but this is pretty much expected. Now here we have the Klatskin needle. We'll easily pass it through the small nick in the skin. The liver is only a couple of centimeters below the skin at this point. And when the patient takes a breath and exhales, the needle is just gently inserted in, and the biopsy is obtained. The specimen is immediately placed in formalin, which is a preservative until we're able to get it to the pathologist to process. And as you can see, this specimen typically is 2 to 3 centimeters in length. It's a small little piece of liver tissue. You can see it floating around in the formalin. And then what we'll do is we will send all of the required clinical information to the pathologist for them to accurately diagnose the problem. Following this, the clean, sterile barrier is taken off, the skin is cleaned up, and a small 4x4 gauze pad is folded over, and a adhesive tape called Tegaderm is placed over the bandage and the skin. And that usually stays on for 24 hours, and by the next morning, most patients are able to shower. Some people feel comfortable keeping a Band-Aid over it for a day or two. But you can see there that it's just a very small bandage that we put on, and the patient is awake and talking with us. Following this, the patient will be sent to recovery. Our protocol is that we keep the patients under observation for 4 hours, monitoring their blood pressure, respiration, heart rate, and any signs of any complications or if there's any pain. But in all the years that I've been doing this, patients with this protocol are quite comfortable in the recovery area. Again, you'll need somebody to take you home because of the anesthesia. In recovery, we have nurses that will monitor you for 4 hours. After about an hour or so, you're able to get some